So I'm going to take a quick break here and just wrap this little segment up and then take it in a slightly different direction.
You're listening to the Medical Hackers with Dr. Sandeep Rao, board-certified vascular interventionalist, bringing you insights on treatments for common medical problems on News Radio 690 KTSM. For more information on the issues being discussed or to contact Dr. Rao, call 915-500-4370 or by emailing rao@medicalhackers.com.
Back to the Hackers, I'm Dr. Rao here, discussing foods with Junie, and we were just kind of discussing the difference between anti-inflammatory foods and pro-inflammatory foods, and there's a lot of confusion out there, but in general, a leafy green item, natural, fruits, apples, blueberries, they all contain a high amount of natural antioxidants that is anti-inflammatory and should hopefully help decrease the inflammation that's going on in your system. Nuts is another one. It's been considered to have a reduced marker for inflammation in your body and lower risk for cardiovascular disease and diabetes as well.
Dr. Rao, nuts in general?
Yes, most nuts.
Okay.
If you think about it, some of those nuts, if you take some nuts have higher concentration of, say, selenium, magnesium, things like that. So it's definitely, I think, a good mixed nut.
Okay.
Package is always a good treat for me, generally.
Yeah.
So I'm going to go in a slightly different direction here and talk about something that came out very recently about early breast cancer treatment, which is an alternative to surgery, something that I actually offer on occasion, not all the time, because we've kind of reduced the number of breast disease patients we're seeing overall, but I want to kind of get into this thing called cryoablation, which involves freezing a tumor in the breast. So when you think about tumors in any woman's breast, it could even be a man's breast, because I do see breast cancer in men as well. So in anybody who develops a breast cancer, the question that always needs to be made during the diagnosis stage is this an early stage cancer? Is this something that we're catching at a very early point in time, where it's a small lesion, it's a small tumor, or has it grown? Has it spread? Has it spread to what we call the lymph nodes?
That's right.
Has it spread elsewhere in your body? Sometimes I see it spreading to the bones. I see it spreading throughout your body. So if we find a patient who has early stage, low risk breast cancer, that's where you have to decide, do you want to have something that's done minimally invasively, or do you want a surgery for it? So what would a surgeon do? A surgeon would typically go in, make a small little incision over the lesion, the tumor, and go in, doesn't have to go super deep, goes in and takes out that mass, creates a nice little margin of tissue around it to make sure that they have captured the entirety of that breast cancer. Now, there are new options that are out there. They've actually been out there for quite a while. Usually we've used this option called cryoablation, which is freezing the tumor. That means that I'm putting a needle in through the skin tissue into that mass, and I freeze it. And usually we've done it for painful breast masses that are not as deadly, like a fibroadenoma that you might see in a younger patient. But now people are applying it for tumors, actual breast cancers. And so that's what came out actually. So the FDA panel recently approved cryoablation as an alternative, an adequate alternative to open breast surgery.
So Dr. Rao, cryoablation, you have a male or female and you cryoablate a tumor. Do you still remove it, or?
No, so what I do is, I identify, the patient comes in, we identify this lesion under ultrasound so I can see how big it is. If it is of a reasonable size, I can't do a super huge mass, but if it's most of these are under, 2 centimeters or so in size, I identify it. I numb up the skin over there, just putting a little bit of lidocaine, so that numbs up that whole area. Then you put in a tiny little probe just through the skin surface. You park that probe right